And now, for those of you who are just joining us, I'm Dr. Scott Kaiser. I'm the Chief Innovation Officer at the Motion Picture Television Fund, and I have the honor of being the MC for today. And now I would like to transition into our next panel with first a few brief messages. One from Trent Stamp, the CEO of the Eisner Foundation. Under Trent's leadership, the Eisner Foundation became the only foundation in the US investing solely in intergenerational solutions, garnering many honors and awards, including Generation United's Leadership Award. And I'll also note that in response to COVID-19, the health crisis, the Eisner Foundation created a rapid response grant program, providing organizations with grants to serve older adults and combat social isolation. As a recipient of one of those grants, MPTF has so appreciative of the way we're able to mobilize to make a difference in life, particularly of older adults in response to COVID-19. And then we'll hear from Dr. Patrick Arbor. He's a nationally recognized expert in the field of elderly suicide prevention and grief services, who's devoted his entire life to increasing awareness of isolation, loneliness, and depression in older adults. He's also the founder of the Institute on Aging's 24-hour toll-free friendship line, which you'll hear about in a moment, as the only accredited crisis line in the country for people age 60 and older and adults living with disabilities.
Hi, I'm Trent Stamp, CEO of the Eisner Foundation. I'd like to thank all of you for joining this year's Social Isolation Impact Summit. Social isolation has always been a challenge in our society, and the COVID-19 pandemic has made our collective work to address it even more urgent. The Eisner Foundation is the only U.S. funder solely focused on intergenerational solutions to major problems in our society, including social isolation. We know this is affecting both older and younger generations at higher rates, but intergenerational programs bring these two groups together to help each other, to learn from each other, and ultimately make our community stronger. Even as in-person programs have been put on hold in recent months, these efforts have persisted. I've been heartened to watch youth organizing to deliver groceries and older adults remotely volunteering with students learning at home. Despite the divisions we so often talk about in our country, at the community level, I've seen us come together to keep people engaged and less isolated. The video that follows shares why and how we support intergenerational programs. But it's important to note that none of this is possible without amazing organizations like MPTF that integrate intergenerational efforts into their work every day. To learn more about these groups, please visit eisnerfoundation.org. Thank you all again for your time and energy and for joining this important discussion. Social isolation is indeed a crisis that we can solve together.
Bringing people together across generations, introducing kids into older people's lives, it can actually have really positive health outcomes. The Eisner Foundation identifies, advocates for, and funds innovative and entrepreneurial programs that work with multiple generations for the benefit of their communities.
It was clear that you took these two complete divergent groups of society and you put them together in all sorts of different ways, and you ended up with a really positive situation.
Our intergenerational volunteers are crucial to our program. They are able to talk to students about multitude of occupations that they've had, travels that they've experienced, people that they've met.
It's amazing how they get connected with each other, and I feel like sometimes they will be friends for a long time.
That's what I want to do. I want to make a difference in someone's life. They can do anything they want to do. You can change the world.
Health outcomes improve for the seniors involved. Their sense of purpose goes up. Children become more empathetic. We've seen them become better learners. And we've also just seen that our society is more compassionate, more humane. People are coming together, identifying each other's differences, and finding out that they're more alike than they think they are.
When you bring these two age groups together, they begin to see the similarities that lays the groundwork for a deeper connection.
It was a window into Samantha's generation. She's kept me young. It's good for my heart. It's good for my health.
The fact of the matter is, society is intergenerational. You can't be anywhere that is not intergenerational. We just have to bridge that gap.
If you're like a lot of older adults, maybe lately you've been feeling a little more alone. But you are not alone. In fact, there's a helpful phone number older adults call when they just need someone to talk to. It's called the Friendship Line California, and we have friendly people ready to chat every day about anything. If you or someone you know is feeling lonely, we're here to listen. Because even if you live alone, you'll never have to feel alone.
Hello, my name is Patrick Arbor, and I'm the founder of the Friendship Line at the Institute on Aging. When we launched Friendship Line 47 years ago, I believed then and believe even more strongly today that meaningful conversations rather than invasive confrontations with lonely, bereaved, depressed, and or suicidal older adults can decrease loneliness. Through creating these ongoing connections, we can disrupt the process of someone slipping into social isolation and experiencing its negative consequences, which can include suicidal thinking. An older woman who lives alone since the death of her husband 10 years ago said to a staff member who calls her frequently, she said, "Without your call, I think I would have died by loneliness." Loneliness and social isolation, which inhibits the quality of life of far too many older adults, is a crisis that we can and we must resolve together.
Wonderful to hear from these great leaders and know the impact that they're having. Now, as we bring up our next panel, identifying and filling loneliness gaps across California, government and nonprofit roles and initiatives to increase opportunities for social connection among older adults. I want to actually just pause to say that those videos are so meaningful to me, as really the genesis for much of this summit was in speaking to these other leaders and looking at the ways that they are working to make an impact, and still seeing that there are many gaps that need to be filled. The Friendship Line is an incredible resource and now has the support from the state level, from the governor's office, from the California Department of Aging. We all need to be on board, and yet we're still finding that we need to work harder to drive people to utilize that resource. We need to find the people suffering in the shadows who could benefit from exactly that type of resource. So with that, I'm going to bring on Nora Super, who will moderate this incredible session. And while we're waiting for Nora, hi Nora.
Hi Scott, good to see you.
Good to see you. Just want to take a moment also to acknowledge one of our sponsors for this summit and the presenters of this particular panel, the Gary and Mary West Foundation. They are an incredible foundation, again, an incredible partner. They're an outcomes-based philanthropy dedicated to lowering the cost of healthcare to enable seniors to successfully age in place with access to high quality, affordable health and support services that preserve and protect dignity, quality of life, and independence. And I'll also add that they have also been doing incredible work in response to the COVID-19 crisis, recognizing the disproportionate impact that this obviously has on older people. And I encourage you to visit their website to learn more about the work they're doing. And again, consider reaching out to them along with everybody in this summit today for potential partnerships and collaboration. So I'd like to also just introduce Nora as the Senior Director of the Milken Institute Center for the Future of Aging. And Nora, I'm not going to make you blush with you here. I know people can go to our website to learn more about your illustrious background and career, but I'm just going to make you blush a little as just say you're incredible. You're an inspiration to me. I first met you when you were leading for President Obama. You were appointed to be the executive director of the White House Conference on Aging. And you just continue to do incredible work, bringing people together, really making a difference in the lives of older Americans. And I thank you for that. And I'm very much looking forward to your session.
Great, thank you, Scott. And right back at you. It's been such a pleasure to work with MPTF on this summit. And while I am located in the Milken Institute's Washington, D.C. office, we have our headquarters in Santa Monica. I am really missing California sun and the ocean now, so I'm hoping we can get back there soon. We've heard some, sobering statistics so far from our previous panel and the PSAs, and from Julianne Holt-Lundstad and Trent Stamp, as well as the expanded outreach that we've seen from the Friendship Line, which is great. I just wanted to share a few stats specifically about California, just to before I introduce our panel. So we know that as of June 28, 2020, there were over 211,000 positive cases of COVID-19 and almost 6,000 fatalities in California. Over 30,000 of these people are age 65 and over that have been confirmed. And unfortunately, we know from recent news that we expect that number to grow as we're seeing a new surge of infections. It's estimated that 7.8 million Californians are 60 and older, and that number is expected to increase by 40% in the next decade. And according to the 2018 California Health Interview Survey, over 8 million Californians 60 and over live alone. From a national perspective, we know that it's about 28% of our population over the age of 65, or nearly 14 million Americans who live by themselves, and nearly 1.5 million in nursing homes and 1 million in assisted living. So a lot of the numbers, as Julianne noted, that were cited in the National Academy of Sciences, Engineering, and Medicine report found that 1/4 of community dwelling Americans age 65 and older are considered to be socially isolated, and a significant proportion of adults in the United States report feeling lonely. And this was pre-COVID. But as we've heard from many of our speakers so far, the good news is that we're seeing some innovative ways that communities are responding to this loneliness epidemic. So now I'd like to turn to the fabulous panel that we have of amazing leaders in California who are on the ground making a difference in identifying and filling loneliness gaps across the state of California. We have a terrific lineup, and you can find everyone's bio on the program agenda. All 4 of these women have really long, illustrious careers dedicated to improving the lives of older adults. So we'll be hearing from Laura Trejo, who's the General Manager of the City of Los Angeles' Department of Aging, Donna Benton, who's Research Associate Professor of Gerontology at the USC Davis School of Gerontology. She's also the Director of the USC Family Caregiver Support Center. Carla Perissinotto is the Associate Chief of Geriatrics at UCSF Health System, and Jennie Chin Hansen, who lists herself as a philanthropic consultant, but we all know that Jennie has held many leadership roles, both within California and across the nation. Right now, she's serving as one of the stakeholder representatives for the California Master Plan on Aging. So welcome, ladies. It's so nice to have all of you here with us. Dr. Perissinotto, I know I didn't do that with enough of an Italian flourish, but if you don't mind, I'd like to start with you. Sure. As a geriatrician, you care for many older patients. Can you tell us how COVID has affected your interactions with these patients and changed the way that you're providing care?
Sure. So I think there's a broad way to look at this in terms of COVID, and then we can focus specifically on loneliness and isolation. I think what was very obvious early in the pandemic is that despite knowing that COVID was disproportionately affecting older adults and communities of color, the guidelines around the care of older adults was largely missing. If you look at some of the CDC recommendations from early on, we were missing a lot of the symptoms that older adults present with. And so that I think had drastic impacts on how the pandemic evolved. And similarly, because in general, we tend to ignore, unfortunately, communities of color, that also disproportionately meant that we had big effects on these communities. What I would also say is that we noticed that, unfortunately, which goes along with a little bit about ageism in this country around the world, is that some of the first clinics that were closing were those for older adults, which seemed very strange to me is that here are populations that are at risk, yet we're going to close those clinics first. And I think that was, you know, it was out of concern for, wow, we have a vulnerable population, we have to be careful. But the answer shouldn't have been to close them, it should have been to rethink. And so what I have found since then is that thankfully now there's a little bit more awareness about how COVID specifically is affecting older adults. But in my practice, where I primarily see homebound seniors, our adults are afraid to come into care. And so what we're seeing is that there has been such a public emphasis on you need to stay away from everyone and socially isolate that it has suddenly become this situation where we're telling people to have zero contact. And so I have had my own patients die in the last couple months, present to the hospital much sicker because they have delayed their care. And so in some ways, I think that this is a direct effect of COVID, but I actually think that in this particular case is a direct effect of social isolation. So what that means is that what we've been doing is that in order to protect our health now against COVID, we are potentially worsening our health and our health of our older communities by telling people stay away from care. So where we are now is how do we find that middle ground to say we need to continue to provide care in a way that is safe and accessible, but it is also in a positive way making us rethink how we provide care to older adults.
Great, thank you. And Donna, Carla mentioned communities of color and how they've been more impacted by COVID. You're also an expert on caregiving, and could you share some thoughts about, you know, what the African American community in particular is experiencing with COVID, as well as what the caregivers of older adults, how they're feeling isolated and unable to, you know, really engage with the people that they love as a result?
Okay, so, you know, let me start with talking about the just caregivers in general, and then I'll go into the African American caregivers. You know, they're the older adults are more isolated because, as the doctor mentioned, they're really afraid, rightly so, of just having contact. But there's, you know, have been limits. So for our family caregivers in particular, they've been really afraid to bring in respite providers. They are, in many cases, delaying taking the person they're caring for maybe routine visits because they don't want to have exposure for the person they're caring for. They're also being challenged in a lot of ways that were not there before. In the beginning, as a normal caregiver, you had these personal you had your alcohol and you could get your cleaning supplies and all of that. And now everyone needs them and they need them for regular care. So for the family caregiver, these challenges have actually closed them off from the community in many ways. Also, if they're caring for somebody who is in an assisted living or a skilled nursing facility, they aren't able to go there like they used to because those are completely closed. And so they really are more isolated because of that, particularly caregivers to persons with dementia, because they were already feeling isolated and alone. Almost 50% of caregivers were expressing depression and feelings of isolation before. But when you're caring for someone with dementia, particularly in the later stage, you don't have anyone to interact with. So now we're sheltering in place. They can't bring anyone else into the house. They maybe those were the people that they could hug and touch. And so all of that physical contact that sometimes gives you that spark of life has been cut off for the caregiver. So while it's still important to actually enhance online support groups and maybe have more talks and help with respite, we're still having difficulty with kind of those group activities that allowed caregivers some respite and ability to interact with other people. And then if we move into the African American and Black communities, we really need to understand that the shelter in place has been very different for that population. Many times it was harder because in those communities, our caregivers in particular, and many of the African American caregivers are in the fields that are considered essential workers. So they didn't have, their exposure. Then they're trying to go back and they haven't been able to isolate. And so if they were caring for someone, it made it harder. So they had to make a choice between going to work and having an income. In terms, as far as being able to connect with other people, for many people in the African American community, the isolation also is a little harder because of the mental and physical mental health outcomes that are there. They may have already been suspicious of the healthcare system, and now they may wait a little longer to even interact with the healthcare system. So they're going to have less chances of reaching out. They may not have the same alternative social support programs in place in their community. You may not have, you already here, you had maybe limited, you had church availability and, you could go to the grocery store. All those things are shut down that were alternatives for African Americans. And then the one thing that I was on a phone call with a group of African Americans, and they were saying for their multi-generational households, this has really been difficult because I like to think, hugs from grandma, that's medicine. And so here you are, you can't hug your grandchildren, you can't hug your adult children. And so that feeling of love that's there just feels very different when you're in a multi-generational household and then you're trying to isolate at the same time. So we find for the African American and Hispanic populations, while they may be in multi-generational households, that doesn't mean that they can't begin to feel lonely and isolated, even with family around, because they're not interacting the same way. You're not getting your medicine the way you had before from hugs.
That's such a good point. Let me turn to Laura Trejo. Laura, I know that you've seen a tidal wave of need in LA when these social distancing measures came into place. How have the AAAs and other community-based organizations in LA adapted to this and innovated under this pressure?
Well, thank you for inviting me to be with all of you today. Your area agencies on aging, I think not only in California, but across the nation, have really stood up to be solution finders with this situation. I can tell you as a gerontologist, I have been so proud to be part of this group of people who, were spending 18, 20 hours a day at the beginning of the pandemic, trying to redirect our systems of support to make sure that we address the changing needs of older adults in our community. We went, just to give you an example, from 200 to 300 calls a week to 3,000 a day. And that is, I had borrowed 160 city employees just to answer the phone 7 days a week. So everything that we did changed extremely rapidly. The great part in talking to my colleagues across the state has been to see the tremendous support that has been available to from each other to make sure that we were all supporting this necessary transition at the scale that it had to take place. Not only rapidly, but also very large scale change that we had to implement. So for area agencies, it's been incredibly challenging, but also I think very rewarding to see, and I heard other speakers this morning talking about the incredible creativity. I see it on the chat. People across the country have really taken this as an opportunity to respond to needs that were always there, because I think what we're seeing right now is they've been surfaced to being priorities that before we were kind of just working on the edges. And this really forced us to confront the need to address, for example, the issues related to senior hunger. We could not ignore that because this became an actual, priority within the pandemic for older adults who were sheltering in place. Quickly, as the orders kept getting extended, folks ran out of resources to be able to provide for themselves. You mentioned people who live alone. Those are the folks that we got calls from first. How am I going to be able to eat if I've run out of everything in the house? And I can't go to the supermarket because I'm afraid. So we had to, really shift how we provided services and support to make sure we were being available to our clients. And so we went from, a few thousand home delivered meals a week to, as of today, we're serving over 20,000 individuals 7 days a week. And when we started, we only had about 4,500. So it's 5 times the number of clients that we're serving. I can tell you, as we closed all of our senior centers, immediately we began to call our consumers, our clients, our participants to find out how they were doing, what did they need, how could we help? Because the concern that we had was we didn't want people to be disconnected because our sites were closed. And we literally closed everything very quickly. So that became incredibly important. The telephone, as old technology as it is, became a lifeline for us with many of our clients. Even as we're transitioning a lot of our programming to online, because we're also using the technology available to all of us, but we're also being mindful that that may not be the only way that we will reach most of our clients. So we've gotten very good at, these conference calls with 5,000 seniors. But you know what? That works. It's a functional use and it connects people in communities. And we're in the process as area agencies looking for technologies across the country and literally across the world at this point to see what we can adapt to provide for the needs of our communities in Los Angeles. So it's a huge task, but it's in process.
Well, it's very impressive. And I know we'll talk a little bit more about some of the limitations of technology when working with older adults. Before I turn to Jennie, though, I wanted to, Donna gave us a snapshot of some of the challenges in the Black and African American community. I know LA has a large proportion of its citizens that are Latinx and English is their second language. Can you share some programs or initiatives that you are working on that address this population in particular?
Not only Latinos, but also Asian Pacific Islanders. Mm-hmm. We have the largest populations of almost every Asian Pacific Islander group that lives here in Los Angeles, and many of those are aging populations. We actually had the incredible opportunity to begin a collaborative relationship with the National Council on Asian and Pacific Islander Aging, because we were trying to understand what our process was. I'll tell you what I did. I actually had my staff early on in the pandemic start making phone calls to resources that we use on an ongoing basis in the languages that I was concerned were not going to have addressed. And I said, what happened? So that I would know before I started handing out those phone numbers to older adults who are monolingual, both English and Spanish. We actually work with very well-established community-based organizations that have specialty in reaching Latinos. For example, the Mexican American Opportunity Foundation is one of our major partners. We look to them for guidance about what was happening in communities, so that, for example, something that was unexpected, older adults in the Latino community started to say, I really cannot accept you delivering more than a couple of days worth of meals. And we were like, why? I don't have a refrigerator. Social determinants became very present for us in terms of the lack of resources in certain communities, in addition to language and cultural expectations of how people expect support from families and the community. So for us, it's been trying to manage, but really looking to our partners who are experts rather than trying to just figure it out. We called them and we said, please help us, hold our hand, and because we want to do it as best as we can. And set up language lines and everything that everybody else has done. But in addition to that, really go to our local partners and ask for their support in helping us manage through all of this. We work with our folks in South Los Angeles. We reached out to them about African American seniors and Black seniors and said, what should we be doing that would be supportive to them?
That's great. And you know, we really is a good reminder to all of our participants today to really work with those trusted community-based organizations who have already established themselves in the community. Go to them for one of the lessons I was discussing just yesterday is learning to listen more, all of us, to say, tell me how we can help.
Yeah.
I want to
look outside your state. Don't limit just to your community. I had to look to the state of Washington for help because it's wherever it's available, what you're looking for. So don't limit yourself to the community.
That's great. And we have several participants from around the country participating. I want to turn to you, Jennie. You know, as a Chinese American yourself, you've talked some about the discrimination that Asian Americans have faced in the wake of COVID, but also some of the really empowering community supports that have been happening. Can you share some of what's been happening in Chinatown in San Francisco?
Yes, thanks a lot, Nora. I'm actually going to build on exactly what you and Laura just mentioned. And when you talk about Chinatown, San Francisco, it's all of about 22 square blocks in San Francisco, but it's very concentrated. It's the second densest population in the United States in terms of neighborhood. And it turns out this is occupied primarily by a large number of older individuals who are by themselves, and they're poor, and speaking about oftentimes being monolingual. What has been phenomenal, and the New York Times covered this, is the city anticipated that this was going to be one of our hot spots by virtue of what I've just described. As it has turned out, this has been one of the safest areas. There's about, in the city's population, about a third of the population is Asian, and it turns out of the infection rate, it's just over 11%. And so what is this? And it goes back to both your points of community, understanding the community. There was huge leadership by the local hospital, a Chinese hospital. The CEO happens to be a nurse executive, but she really listened to some public health news that was coming across. She mobilized the community organizations that are in this area. And then secondarily, she also was in touch with the housing organizations. And so that combination, coupled with using the media and radio, this sense of information flow as well as education and understanding how people live, going back to your comment about listening and understanding and asking questions. People live in these single room occupants places, 8 by 10, sharing a bathroom with perhaps a dozen other people, as well as a centralized kitchen where people cook. I mean, from a public health infection concept, I think you can see the risk here. But the fact that they were able to manage this, and it was because people came together and really saw this as a high risk population and mobilized its collaborative efforts together. So that's an example, I think, of how a community wraps its arms around a population known to be at risk, deploy the mechanisms, use trusted resources and communication. And right now, it's amazing to have this be at this point of steady state. But the respect for underlying community structure, practices, and leadership, absolutely important.
Great. Well, let me just open it up to all of you all. We touched on technology, and that's been a theme of today, ways that we've been able, all of us, we're on Zoom now. We've all learned how to use Zoom more and communicate with people. We have family meetings via Zoom, you know, but for some older adults, those ways of communicating don't work as well if they don't have access to a computer or broadband. Can you just anyone who wants to jump in, let me say Jennie wants to, and it looks like Carla does too, about some of the challenges, Donna too, about, some of the challenges and also the opportunities that we see with technology. So let's go to Jennie first, then Carla, then Donna.
Well, I'm going to defer to my colleagues to talk more deeply about the technology as a tool. What I'd like to raise that was brought up actually in the introductory video and with the Eisner Foundation's work is a part of my passion now is really thinking about the not only the immediacy of this period when we have a pandemic, whether it's this one or the next wave, but this whole elevation and greater visibility of intergenerational connectedness. I think Donna pointed out some of the risk factors when you have this multiple generations in a household. There also is the whole concept of some strength-based way of looking at it from a broader community. So this is, there are many organizations doing this. I saw some of the notes go by about how important that interaction is, but I wanted to pick up from this earlier, Mark Friedman, who is head of the Encore.org, has for the past probably 5 to 8 years worked on a subset of the organization called Gen to Gen, generation to generation, and there's a plethora of resources, be it housing, projects that have already been in existence for over 25 years that low and moderate income families, both older as well, older single individuals and families have that kind of networking. So on the one hand, the immediacy of meeting loneliness and isolation contacts, but building a structure that once again, a sense of interconnectedness and also agency. So one of the things that I think this concept of intergenerational offers is the concept of venerable versus vulnerable. So the fact that we bring out the strength of that possibility. So I'll leave it at that, but Gen to Gen and many others, some new ones called Eldera, the Mon Ami, they're app-based supports that are intergenerational. But this is an area I think we should move forward. This is an opportunity. It's not going to happen overnight, but we've got to start.
That's wonderful. And, you know, it reminds me, there was a story in the Washington Post about some teens in Montgomery County that started grocery shopping. One started grocery shopping for his grandma, who had a neighbor who also needed grocery shopping. And now it's spread to 14 different states. And what's been great is these teenagers have said, you know, they have a lot more respect for their moms, yay, because they found grocery shopping takes a really long time unless you know where to go, and they become more efficient. So as we know from these intergenerational projects, there is a greater respect for different generations when we work together and can build on each other's strengths. Carla, you wanted to add something about technology.
Yes, I could probably add too much, but I'll start with saying that during the pandemic, my colleague Ashwin Kotwal and I have been undergoing a study of actually understanding the effects of COVID on people, primarily in the Bay Area, looking at loneliness and isolation and unmet needs. And in that study, what we have found so far is that 79% of our participants, and this was a pretty diverse sample with a mean age of 75, had minimal to no video interactions, 79% of the sample. And 43% had minimal internet use. And so the reason I bring this up is that I see technology as a tool, but I'm very worried. If you read in the chat, there's so much there about websites, training people, but how do you train people if you can't do it in person? How do you train people if they don't have broadband access and they can't pay for a phone that has data? So this is both an age issue in terms of the digital divide, is also a socioeconomic issue. And so, I also noted that Sachin Jain earlier was talking about, the move to more home-based care and how much can be technology-based. What I've seen in my practice is a mix, that some people can participate, but there is a huge gap. And so this is a policy opportunity for us as well to think about, not only are we providing access and reimbursement for telemedicine, but what is the training for people and what devices are we supplying for people? And then the last thing I'll say before I talk for like 5 hours about this is that technology, what the problem right now is that we're expecting older adults to adapt to it rather than creating technology that is for older adults. So 2 questions for whoever's listening. Why has Apple not actually created products that are more user-friendly given the large proportion of aging? I don't want to offend any colleagues on Zoom, but Zoom is so difficult for my patients. The number of patients that can't connect to audio and that don't have real-time texting for people with hearing impairment, those are huge gaps and such opportunities for us to actually serve the population rather than just expect everyone to adapt to technologies that were not built for them.
And several people have raised the issues about sensory impairments for older adults and how that's a challenge. So I thank you for acknowledging that. I want to turn to Donna to add on this. And also there was a question that came in for you, Dr. Benton, about the resiliency of caregivers just in general. Have you seen that sustained during COVID, or has it become more challenging? So both the technology issues and then that question from the audience.
Okay, very briefly, technology, I always like to remind people that we always still have our very low tech ability to use a telephone. And so many of, and I'll give you an example of what happened with us when we were trying to upgrade our support groups to add a Zoom and video feature. One of our peer support groups, they tried it out and they said, you know what, this isn't going to work for us. Can you set up something else? So we just set up a big telephone interactive group where they could still have the support group, but everybody just got to call in on a conference line. And they have been able to use that to maintain the support group. And so I think that we have to always remember that there's a continuum on our technology, and it's important to listen and adapt. But the phone has been there and doing old-fashioned phone trees, and people also use, if they're using Facebook at all, how we can adapt that. To think about resiliency, the nice thing about resiliency is, you know, what does that mean is we'll get through this, and you've been through something similar. So with age, we have built up experiences that allow us to realize that things go bad. We've gone through that, and then we come out on the other end, sometimes with more experience, better ways to cope, or we've coped before. We remind ourselves that we can cope through this. So the resiliency in the older adult population, I think has to be, you have to kind of reinforce that. But I also hear older adults talking to me saying, you know, we've gone through periods of hardship before. We remember what happened during the last downturn. Some are even older and remember other hardship times. For African American communities, resiliency has been what has helped us get through racism and normal living every day throughout our history. So being able to roll with the punches and come out and learn and adapt, it has been very important. And we can learn resiliency as a community. You can actually, there are a lot of videos on resiliency right now, but you can just do some techniques. But I always, you know, start with one of the basic ones is just thinking about what has happened in your past that maybe was at the time very difficult, but you look back and say, I grew a little bit from going through that hardship, and see if that can help you right now.
That's great. Thank you so much. And you know, your message about the phone line reminded me of my husband's grandmothers used to call each other and a group of other friends and play Scrabble. You know, they'd have the things, they'd move it, and they'd talk to each other about it all day long. So there are more creative ways we're learning to communicate through this, to stay connected. I know we're getting so many messages and questions, and everybody wants to ask you things. So I just want to tell our viewers that we will be partnering, the Milken Institute will be partnering with MPTF to write up a report based on this. We'll look at all the questions, try to respond to everything, because we can't have enough time to discuss all these issues of importance. I wanted to go back to Carla with a question. I know this is something all of you all have struggled with a bit, with the budget cuts that are occurring because of the economic downturn. Not only have people lost their jobs and you know, many of their own resources, but governments too are struggling because they don't have the same tax revenues that they had before. And I know Carla is doing a study. One of the things that challenges us with social isolation is really studying what interventions work and being able to say, we all know sort of anecdotally, it sounds great that I would call this person or do that, but does it really improve their health? Does it really help them? And I know that you're working on a study like that. Can you tell us what you're finding now and sort of some of the challenges you've had with that?
Yeah, so again, what's really fascinating is that we have so much data, as you know, about the health effects of loneliness and isolation that we've heard this morning, we've heard over the last couple of years, and we also know about the financial implications. What's fascinating and also relevant to the National Academy of Sciences report is that the huge gap in the evidence is interventions. And reading the chats and seeing these phenomenal organizations doing amazing work, the onus is on you and on all of us to show that they work so that we can go to our payers, we can go to Medicare and we can go to Medicaid and say, hey, my program works and I can save you money. By the way, I'm not doing it to save money, I'm doing it because it's the right thing to do for people, number one. So what we're doing, as I mentioned, is that my colleague and I are studying the effects of loneliness and isolation and looking at specific programs. So we're looking at programs like the Friendship Line. We want to study the effects of the Friendship Line in California, but we are currently unfunded. And that is very difficult, therefore, to show the evidence. And what a great opportunity right now to have Friendship Line California and to be able to show on a massive scale with a very diverse population, how does this program work? Who does it work for and what does it actually do? So that is our onus because that is what we need to show, because so far what we have found is that there are three trajectories we've seen for people during this pandemic. 43% of people in our sample so far showed a worsening of their loneliness and a worsening of their depression and anxiety. So we already know that this is going to be costly and going to have downstream health effects. There are some people whose loneliness and isolation are staying the same. And those are some people who are already isolated and lonely at baseline, so don't see a difference. And then there's some people that are actually seeing an improvement because people are reaching out. So the question is, for our programs reaching out to people, will they continue post-pandemic, or will we go back to forgetting about older adults? The last things that I'll say that we've found are the unmet needs. So Laura mentioned the food insecurity. We've seen that in about 20% of our sample, but surprisingly, 80% of our participants had trouble accessing medications, which is very surprising considering how many people are delivering medications. And I wonder if it's because many of those things are actually technology-based and you have to get online to do your delivery. So there's so many opportunities here to really understand the social determinants of health, who is most affected, because it's already people who are vulnerable and they're going to be impacted more.
That's great. And I'm going to go to you, Laura, because we've only got 5 minutes left, and I just want to let each of you respond to Carla's provocative question. Are we going to go back to where we were before COVID in terms of engagement and reaching out to our seniors, or can we have hope that this may actually be a silver lining? Laura.
And I'll tell you where I feel as an advocate that the hope is. The hope is that we have their attention. We have elected leaders, policymakers, funders attention right now because older adults are at the highest risk group. This is an opportunity to educate them. I have taken that very personally and very seriously. I am making phone calls to elected officials and saying, let's talk about older adults in your community. What can you do to help me? It's been remarkable. They were all waiting for the phone call, believe it or not. Many of them initiated the calls to me, but the majority, I initiated phone calls to them, their chief of staff, and say, I just want to brief you on what we're doing in the community in your area. As a result, I've launched new programs. They have become personally involved and engaged. These people make decisions every day. They will continue to do so. And right now we have an incredible opportunity, those of us who work with older adults, to be front and center in their attention. That helps on an ongoing basis to make sure that we're keeping them informed and advocating for the priorities that we want to see happen. I had an elected official say, well, if you had to tell me what your 3 priorities are, I said, I will have them emailed to you when we hang up. And I did, because I already had a list. So have your list ready and get them ready to go.
That's right.
This is a great opportunity. Don't miss it.
Thank you. Jennie.
Yeah, I would say one of the things that that has been wonderful is the warmth and compassion that is coming toward people. And I mentioned earlier the idea that, you know, there is capacity and ability in a lot of us as older people. And so often programs are designed for us. It's not listening to us and understanding how we think about it, what would be helpful. You know, Carla, your comment that 80% of them, the issues were about medications. And you know, like that was a light bulb for me. Of course it would be, but part of it is designing it with people is something that I hope will get sticky, not that we just do for people. So I think this concept of listening fully, robustly, and testing and making sure we're meeting a need, not even though in our heart of hearts, in our beneficence, we think this is good for people. So I leave that it's a shift that oftentimes public programs have a tendency to do to people on their well-being. But I think it's time to understand there's a lot of strength in the community. There are a lot of strength in people and in you know, family or related or not family. It's a different way to think, and we need to spend that effort to design it, because believe it or not, it probably be both stronger in outcome, but possibly less resources needed than we think there are.
Such a good point, but we need to study it to prove that, right? Donna, would you like to add something?
I would just add that recently in speaking to an advocate, he said that policymakers tend to think of policies about what we want to get out of, you know, like let's get people out of nursing homes, let's get them out of this. He said, but it's very important to also think of what are you putting people into in a community that might be under-resourced and underfunded. So if we don't have our funding and policies that help support the communities in which we want to place people back into or have more things in the community, we aren't going to get very far if we continue to underfund these programs. And a lot of that for many communities has to do with institutional factors around health disparities and health institutional problems and funding in general. So we have to always remember that we do need funds. We are generally, we are resilient and we kind of make up programs and bring in social services, but it's nice to get a few pennies every once in a while too.
Well, thank you for that. I think I could talk to you all day. It's been so interesting. And we will follow up with a report. I really enjoyed all of this. I learned so much from you all. And let's build on this, all work together to, you know, definitely increase funding and research in this area, but also raise awareness of all the resilient innovations that are happening in communities that can make such a difference in a person's life. Even if, as we were talking earlier, even if it's just stopping by to a neighbor's house who you know lives alone and asking if they need anything, it can make a huge difference. So thank you so much for being with us. And now I'm going to turn it back over to Scott.
Well, thank you, Nora, and thank you to that incredible panel. And, you know, I'm feeling so inspired. I hope you are too. Designing with venerable rather than vulnerable, resilience, and oh, by the way, funding would help. So resilience, and please funding. I'm seeing incredible activity in the chat. I'm seeing incredible questions. I'm glad that Nora highlighted that the conversation will continue at mptf.com, and look forward to a report from the Milken Institute Center for the Future of Aging. And now I'm going to be joined by Maureen Feldman, MPTF's Director of Social Isolation Impact Projects. Again, here's Maureen as we're talking about impact. This has been an incredible opportunity. We're hoping that everybody who attends feels that they leave with at least one person or organization that they're hoping they can reach out to collaborate with. So again, this is we can't solve it all in one day. This is to initiate a conversation, initiate collaboration. We also are hoping that people feel their experiences are reflected. I'm seeing things in the chat from people who are talking about the experience of feeling isolated in senior housing, of feeling isolated in certain, across different communities, of access and equity issues. So we want to make sure that this is reflective of all experiences and that we make sure to highlight that in the continued conversation. So as someone who's been driving collaboration and who has impact in their title, let me turn it over to Maureen Feldman. Maureen, thank you for being here today.
Thank you for having me, Scott, and thank you to all the great panelists and for all the attendees who are out there who I know are going to take this information to really drive impact as we move forward.
Absolutely. And Maureen, I know you've prepared a brief presentation just to give an overview for all of our attendees of some of the work that MPTF has been doing to reduce loneliness and social isolation, particularly in response to COVID-19.
Right. I'm so moved by the incredible ways that MPTF has stepped up across our entire organization to address social isolation as our COVID-19 response. Bob mentioned our in-house television channel 22 launched Organized Chaos as an innovative and fun way to keep our residents connected. And our new Care Calls program that began reaching out to our retirees to see if they needed support.
And Maureen, let me just interrupt for a second because I believe our producer's gonna bring some images up as well.
That's right. Oh, with great photos too.
A little bit of a visual of what you're working on.
Yes, yes.
But with that, yeah, please proceed. I want everybody to know about the great work.
Yeah, the chaos, the organized chaos was amazing, as our care calls were as well. And our established social call program, the Daily Call Sheet, actually experienced a 41% influx of new volunteers and referrals just since March. So we doubled and tripled the number of calls we were making, and we started teaching recipients how to order groceries online. All of these calls came for this simple telephone. The Daily Call Sheet program connects volunteers across all generations, providing social engagement opportunities to some of our most vulnerable community members through the simple telephone. Many volunteers find value and purpose in making these calls.
You want me to put it on my, yeah, I'm done.
Since these are regular calls, bonds of trust are formed, and volunteers often discover secondary needs, such as food insecurity, housing, and transportation issues, allowing us to connect recipients with other much needed resources. As one recipient put it, these calls are like a verbal hug, something we need now more than ever. So we continue to work with our Social Isolation Impact Coalition, which we formed following our first summit. And when COVID hit, we received multiple requests for guidance from organizations looking to launch programs similar to ours. So we jumped right in and began sharing toolkits we developed with AARP Foundation, guiding dozens of organizations across the country through virtual trainings, which helped them get started. And this led to a wide range of incredible programs being launched, from seniors helping seniors and faith-based groups, food delivery programs, even high school students looking to reach out to make a difference. So it's been really inspiring to see all the ways organizations are meeting the needs of the communities. But still, we found that there are tools we could do to use and make this better. That's why we created the MPTF Call Hub. The Call Hub provides an end-to-end solution which enables organizations an effective way to manage their social call programs. One of the best benefits is it provides a single toll-free number, which is convenient, but also enhances safety and privacy. Through the hub, organizations have an administrative dashboard to manage volunteers and recipients' information. It tracks data like the number of calls made and who is, and most importantly, who might not be receiving calls. And the volunteers also have access to a dashboard where they can communicate any concerns that arise. So with everyone now connected on one network, we can effectively get information out to individuals through emails, through automated phone calls, which are really critical, especially during a pandemic. So
thank you. That is a lot to share in a brief amount of time, and I know there's more to share. That's why we want people to visit mptf.com. Thank you for sharing about the incredible work you've been doing since 2016 with the support of the AARP Foundation all along the way. And then now you mentioned the Call Hub.
Yeah.
So I'd like to acknowledge Twilio. Actually, Twilio.org is one of our sponsors today. So Twilio is a company I had never heard of, and now I see is everywhere. It's a cloud communications platform. So behind the scenes with all of your messaging and chat, you know, everybody was talking about access and designing inclusively. Well, if you want to use a phone, a text, a video, any way to communicate with people, Twilio provides the actual code and building blocks to do it. And Twilio.org is the social impact arm of Twilio that has an incredible mission. I encourage you to visit their website. And they've actually dedicated millions of dollars to supporting organizations with hotlines and outreach programs to do all the incredible things that we're all seeing and so inspired by, you know, telephone trees, check-in programs, grocery delivery. All of that needs communications. And so Twilio.org helps nonprofits communicate, which we all need to do. And Maureen, we're encouraging people to partner with us on the Call Hub.
Yes, absolutely. One of the things about the Call Hub we didn't talk about, and Carla had mentioned, it's a powerful tool for research. We need more data to make these programs more effective and impactful. So yes, we encourage you to reach out to us. We are assisting organizations that want to launch programs or improve an existing program so they can have structure, a strategic way of collecting this information so that together we can solve this crisis.
Absolutely. Thank you, Maureen. And that's great. We've been offering the Call Hub as a end-to-end solution free for nonprofit organizations looking to solve this crisis together. So Maureen, it was great having you here. Couldn't imagine doing this summit, our 4th summit, without you being a key part of it in terms of all the great work that you've been doing, leading efforts at MPTF. And now we're gonna bring up a video from one of our partners who we've also worked with along the way, Dr. Jeremy Nobel and the Foundation for Arts and Healing.
It's our pleasure to welcome you to the launch of the 4th annual Unlonely Film Festival. Loneliness is the uncomfortable feeling that we don't have the social engagements that we want. It's the gap between the connection with others that we seek and what we actually experience, and it can have devastating consequences.
Loneliness saps vitality, reduces productivity, and diminishes enjoyment of life.
Over half of us are often lonely, and as many as 1/3 of us are lonely right now. The Unlonely Film Festival is part of the Unlonely Project, the signature initiative of the Foundation for Art and Healing, whose mission is to explore and promote the idea that creative arts expression improves the health and well-being of individuals and community.
As a society, we thrive when we are connected.
Now more than ever, we need to connect with one another and tell our stories.
The arts help us engage in meaning and in purpose. They inspire us.
Stories unite us by shedding light on the differences we see and those we cannot see.
So this unique festival and the work of the Foundation for Art and Healing could not be more timely.
We're here to launch something, a streaming film festival called the Unlonely Film Festival, whose goal is to get 1 million people to come see short but powerful films on a topic they would most likely rather ignore. I hope you share our view that we need to move from the grim statistics of loneliness and its painful burdens to doing something about it. And that's what the Unlonely Project is all about.
Everything you do, you will learn from it and you'll use it later on in life.
All of you, you're beautiful. I'm here to prove no matter what you're going through, you're gonna all rise above it.
Outstanding. So yes, let's help the Foundation for Art and Healing get to 1 million viewers on their Unloneliness Film Festival. I know Dr. Jeremy Nobel should be joining me now. He is a physician. He's also a public health expert. He's on the faculty of Harvard Medical School in the Department of Global Health and Social Medicine. He's also a poet, a photographer, and a teacher, a true practitioner of the humanities, and my friend and colleague and inspiration. So I'm just really so glad you could join us here today, Jeremy.
It's my pleasure, Scott, and I wanted to thank not just you for the chance to be here today, but the work MPTF does leading in this field. What you and Bob and Maureen do is really on the leading edge of, connecting all of us, older adults, caregivers, and so on, using technology, but using humanity primarily. So thanks to you. And I also wanted to thank Paul and Nora for the unbelievable tenacity with which they spotlight this issue. And then finally, AARP Foundation sponsoring not just this event, but much of our work. And we do, we talk about creative arts as a way to connect. And some people say, well, gee, Jeremy, you're a primary care doc, what are you doing with that kind of fluffy stuff, the arts, that's nice. But in our work, it's clear it gets to the center of who we are. It allows us to be inspired, to be in touch with thoughts and feelings, and then to share those with other people. And so, yes, we use films. That's a very powerful way to tell stories, Scott, as you know. In fact, you do that at MPTF. I noticed in Maureen's early little set of slides, there were pictures of the film studio you have.
Of course.
And I've been on that studio, and it's really remarkable how engaging it is to share stories. The arts have been with us for a long time, and it's not an accident.
Yep, and to see in response to COVID-19, obviously as physicians, there's this call to the front lines, and you think ventilators, personal protective equipment, isn't that more important? But as you pointed out, no, this is just as important. And look at the data, look at Julianne's data. And so that's why we're always emphasizing that.
The data is compelling, and I'll just leave that. I've been following the chat here. Clearly, there's a remarkable collections of individuals and organizations. And just let you know about 3 things we're doing that may be relevant. We'll have our team put some contact information into the chat. So the first is the film festival, and we are on our way to 1 million views. There are 1,000 people right now on this webinar. If you come see us and bring a friend, we're at 0.2% of our goal right today. But seriously, these films are energizing. You don't have to watch them alone. Watch them with friends. Watch them with your family. You can watch them on Zoom. The second thing we're doing, and a big shout out to AARP Foundation again, is a destination website called Stuck at Home Together. We'll put the URL in the chart, that actually invites people through creative activities to share their stories of COVID-19 and tips and guidance to resources and so on. And then our last activity is actually taking some of our Creative Circle curricula, converting them to virtual delivery capability, not just face-to-face, but then also very excitingly, and the conversation here has been dynamic around it, making it available audio only, so that we can enhance some of the social calls with very purposeful creative arts prompts, introductions to imaginative ways to connect and feel that you're being seen and heard in these very difficult times. So thanks again to you, Scott, MPTF, Milken, AARP Foundation for really shining light on this area, but more importantly, doing things about it and giving us a space where we can all share our collective activities.
Thank you, Jeremy. Thank you, everybody. I encourage you to check out those resources right there in the chat. Visit the Foundation for Art and Healing website. And Jeremy, thank you for just being an incredible connector and collaborator. Can't imagine solving these challenges without you. And just wonderful to count you as a friend and collaborator.
Well, we're all doing it as a community together, Scott. And my last guidance is stay calm, stay creative, and stay connected.
Love it, love it, love it.